Malaria is a life-threatening disease caused by parasites. About 3.2 billion people are at risk of malaria. Most malaria occurs in sub-Saharan Africa. However, Asia, Latin America, and to a lesser extent the Middle East are also at risk. In 2015, 95 countries and territories had ongoing malaria transmission. Some population groups are at considerably higher risk of contracting malaria and developing severe disease than others. These include infants, children under 5 years of age, pregnant women, and patients with HIV and AIDS, as well as non-immune migrants. According to World Health Organization estimates released in December 2015, there were 214 million cases of malaria in 2015 and 438,000 deaths. Sub-Saharan Africa continues to carry a disproportionately high share of the global malaria burden. In 2015, the region was home to 88% of malaria cases and 90% of malaria deaths. In areas with high transmission of malaria, children under 5 are particularly susceptible to infection, illness, and death. More than 2/3, 70%, of all malaria deaths occur in this age group. Vector control is the main way to prevent and reduce malaria transmission. If coverage of vector control interventions with a specific area is high enough, then a measure of protection will be conferred across the community. 2 forms of vector control, insecticide-treated mosquito nets and indoor residual spraying, are effective in a wide range of circumstances. Early diagnosis and treatment of malaria reduces disease and prevents death. There are currently no licensed vaccines against malaria. One research vaccine against Plasmodium falciparum, known as RTS-AS01, is most advanced. This vaccine has been evaluated in a large clinical trial in 7 countries in Africa and received a positive opinion by the European Medicines Agency in July.
Is the commonest mosquito-borne viral infection in humans. Every year, over 100 million people get infected with dengue, and around 10,000 people die from it. It used to be localized to Asia, South America, and Africa, but increased global mobility due to tourism and migrations is slowly making dengue a global disease. Dengue is an RNA virus in the family Flavivirus. It has 4 different antigenic varieties. Infection with one type provides lifelong immunity to that type, but only short-term immunity to the other types. If you get a subsequent infection with a different type, it increases the risk of developing severe complications of dengue. Dengue is transmitted mainly by the mosquito Aedes aegypti, which breeds in standing water containers such as tires, barrels, and discarded bottles. The mosquito becomes infective about 2 weeks after feeding on an infected person and remains infected for life. Symptoms appear about 5 to 6 days after the mosquito bite. Dengue can present in many ways. Some patients are asymptomatic or develop only a mild fever. In classic dengue fever, the patient gets fever for about 3 days. The fever then subsides and returns again in a couple days. This biphasic pattern of fever is called saddleback fever. Fever is associated with fatigue, skin rashes, retroorbital pain, and backache. It's also called break bone fever because of severe joint and muscle pains. Dengue hemorrhagic fever is a severe form of dengue. It's believed to be the result of 2 or more sequential infections with different antigenic types. It starts as a mild upper respiratory tract infection. Then, all of a sudden, plasma of the blood leaks into the pleural space and peritoneal cavity. This phenomenon is known as capillary leak syndrome. These patients also have low platelet levels and may develop bleeding into the skin or gastrointestinal tract and go into dengue shock syndrome. NS1 antigen testing or virus isolation can be done in the early stages of fever to support the clinical diagnosis. Antibodies specific to dengue can be identified after the initial phase of the disease. There is no effective cure for dengue, but supportive care is essential to prevent death from complications. One dengue vaccine has been licensed so far, but there are a few issues about its safety. Destroying the breeding sites of mosquitoes and applying mosquito repellents
घर में अंडे देने से हमें कोई नहीं रोक सकता। मैं रोक सकता हूँ। तुम्हें पता नहीं हमें एडिस मच्छर जो फैलाते हैं डेंगू और चिकनगुनिया। मास्टर जी ने स्कूल में डेंगू मच्छर से बचने की सारी जानकारी दी है। अच्छा बच्चों, हमें चैलेंज जगह तो जरूर मिलेगी। नहीं मिलेगी, नहीं मिलेगी। यहाँ तो पूरे इंतजाम है।
डेंगू की रोकथाम के लिए कूलरों के पानी को हर हफ्ते बदलें। बाल्टी और टंकियों को अच्छी तरह से ढककर रखें। पूरी आस्तीन के कपड़े पहनें। मच्छर भगाने वाली क्रीम, कॉइल और अगरबत्ती का इस्तेमाल करें।
डेंगू से लड़े मतलब डेंगू से बचे।